Allergies and asthma can cause watery eyes, sneezing, and other issues, but some studies show that allergies may also impact one's emotional well-being. Dr. Reena Mehta with Uptown Allergy and Asthma joins us now to explain. Good morning. How are you?
Good morning. I'm doing great. How about yourself?
Great. Thanks for asking. All right, so we're talking about allergies, and definitely, that we're in that season now where we're seeing folks sneezing and the itchy, watery eyes, especially as spring begins to turn into summer. There's a lot out there that can impact folks. And this month is Allergy Awareness Month. Is that right?
Yeah, so this month, May, is National Allergy Asthma and Awareness Month, founded in 1984. So this is a great time of year, especially with it being peak pollen season, to really draw the public's awareness and educate people about allergies and asthma.
I mean, and it's big. It's important to educate folks, even those who may not have allergies or may not have the reactions that some people do, and that's because we were just talking about it. That people who have allergies may feel a sort of stigma because of those allergies. Is that right? And that might be impacting their emotional well-being.
That's exactly right. So there was a recent survey that was published that showed that many people who don't have allergies and asthma may actually have negative perceptions about people who do have allergies. So for example, about 1/3 of people who responded to their survey stated that they felt like people with allergies sometimes exaggerate the severity of their illness or sometimes fake their allergies because they don't want to eat certain foods. And so you can imagine if you are an asthma or allergy sufferer, that can be really hurtful. And sometimes if you have allergies, you may feel like, isolated, you don't belong. You may feel that people are judging you for your allergies, and that may lead to negative impacts at work. Maybe you don't work to your best ability. You don't go to as many social interactions because you just don't want to deal with it. You don't want people minimizing your allergy. And thus that can lead to a lot of anxiety and depression about your underlying allergies.
Yeah, and so it's interesting the way that you explain it too, because initially when I was reading about this, you kind of question, okay, is it the allergy itself, that reaction that's causing something in the brain to make you feel that way? But it's really the way other people treat each other. So which makes it even more important to be aware of allergies, to know that these are real things. These are things that impact people negatively already, and we don't need to hamper that by negatively impacting them ourselves.
Exactly. So, I mean, some people don't realize that allergies could actually be life-threatening. If you are allergic to a food and you ingest that food, you could have a life-threatening reaction. And so actually another recent study showed that kids actually felt like they could protect themselves from the allergen itself, but what they couldn't protect themselves for was how other people responded or people who didn't care about their allergies. So you can imagine if you're a child and you feel like, well, I can avoid peanuts and that's easy. But the problem that really makes me worried is how other people respond to that allergy and how other people minimize my allergy because they don't think it's a big deal.
Yeah, that's certainly something interesting, especially for kids in school, who may be kind of looking out for what's coming along the way, and other kids may not understand that. So what can we do going forward, and what should someone who has those feelings do if they want to try and mitigate that?
So if you are an allergy or asthma sufferer, or if you have a child with severe allergies, it may be a good idea to seek mental health guidance. You might decide to see a psychologist. There are specialists who actually deal with food allergy anxiety. I recently had a patient ask me about that because, she's in college and she's really fearful. She's been protected her whole life, and now she's out in the real world and is really kind of scared about how to manage that herself. And so really trying to not only take care of your mental health, but also educating others. And so it may be that people just don't know that these allergies can be life-threatening. So, anywhere you go, educating people about this is what an allergy looks like. This is what happens to my asthma if I have the right trigger. This is how to use an EpiPen. So really just educating the public about the fact that not only allergies and asthma can be a real thing, but it could be potentially life-threatening, and just not to minimize it, especially when you go out to public settings like restaurants and things like that.
Yep, it's something that we can all work on. Thank you, Reena. We certainly appreciate you joining us this morning.
Thank you so much for having me.